Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today I'm talking to Dr. Clare Scullin and Dr. Joanne Brown from the Medicines Optimisation and Innovation Centre in Belfast. And we're talking about the I Sympathy project, which is about how we're tackling polypharmacy. That is, the question of multiple drug therapy. Dr. Scullin, Dr. Brown, why don't you start by introducing yourselves and telling us a little about your role at the Medicines Optimisation and Innovation Centre?
My name is Clare Scullin. I am a Senior Research and Innovation Programme Manager within the Medicines Optimisation Innovation Centre in Northern Ireland, and that is quite a mouthful. The Medicines Optimisation Innovation Centre is the only dedicated medicines optimization centre in Europe, and we are funded by the Department of Health in Northern Ireland. We're based in the Northern area, our Northern Health and Social Care Trust, and we're uniquely positioned to work alongside both the health sector and the private sector to deliver better patient outcomes around medicines optimisation. And in terms of my own role, I am one of a team of programme managers that work in the centre. And we generally have a portfolio of projects that we will work on at any given time. To date, I have focused on medicines optimisation, the ever-evolving medicines optimisation that's been happening in the Northern Trust over this past 20 years, really. And at present, I am the project manager for the I Sympathy project, which is a joint collaboration between ourselves, the Republic of Ireland, and the lead partner in Scotland.
Thank you very much. My name is Joanne Brown, and I'm one of the 3 clinical pharmacists who are working on the I Sympathy project in MOIC and in the Northern Trust. And I suppose we should say what I Sympathy stands for, which is implementing, stimulating innovation in the management of polypharmacy and adherence through the years. So we are the team of pharmacists who are working on the ground to deliver the medication reviews, see how we're getting on as we go through it, and collect our data and onward dissemination and training to other staff.
Let's get right into the topic. What is the background to the I Sympathy project?
The I Sympathy project itself follows on from a successful European-led project, Sympathy, which was also led by the Scottish Government. And it was a project in which we were involved in as well. And it was really a European-wide project to tackle the growing global issue of inappropriate polypharmacy. And we worked with a number of European countries where we tried to determine what level of polypharmacy guidance there is out there. And what we ultimately discovered was that there actually wasn't a lot. So I Sympathy is sort of building on that and using some of the information that we learned from the Sympathy project to address the issue of inappropriate polypharmacy.
And tell us, what is polypharmacy and why does it matter so much?
Polypharmacy is taking a number of medicines, and it may not always be inappropriate. So there are times when it is appropriate to take lots of medicines. We have patients that have lots of morbidities, but sometimes polypharmacy can be inappropriate, and that might be where the medicines are no longer suitable for the patient. We've aged and our kidneys may not function so well, and lives change, lifestyles change. We may have a number of prescribers who are prescribing for the one patient. There may not be great communication there. And patients may not get the intended benefit that was expected from their medicines. And also adherence, it can be quite difficult for patients to be adherent to lots of medicines. And we know that if you take one medicine, there's about an 80% adherence with that. But once you're getting into more than 4 medicines, adherence drops to 50%. So we're asking those questions, are you taking your medicines? And we certainly know that the more medicines you take, the more likely you are to have an admission to hospital. So If you're on more than 10 medicines, you're 300% more likely to be admitted to hospital with an adverse drug reaction. And that costs a lot of money annually. Globally, it's something like £18 billion is spent on adverse drug reactions, and 8.2 million admissions every year in the EU to hospital with adverse drug reactions. So it's a big, big problem. But we have to remember that each of those adverse drug reactions are happening to a person, to a patient, and it's that patient who is suffering the ill effects of medicines, coming to harm, getting admitted to hospital. So we need to always bear in mind that patient. And that's what our I Sympathy reviews are aiming to do, is to increase adherence, but to decrease this inappropriate polypharmacy that could potentially cause harm.
Those are huge numbers. Were there any specific recommendations from the Sympathy project?
Yes, there were 6 key recommendations from the Sympathy project. The first of which was to use a systems approach with a multidisciplinary clinical and policy leadership to then nurture the culture that encourages and prioritises the safety and quality of prescribing. We wanted to ensure that the patients were central to that decision making, and that they felt empowered, that they were able to play that part in their own medication role. We obviously, with everything, you need data to drive the change and to measure those outcomes. We want to adopt this evidence base, and lastly, we want to utilise, develop and share the tools to support the implementation. So our I Sympathy program will train pharmacists and other healthcare professionals to undertake structured medicine reviews in line with the guidance and the best practice that we developed during the initial Sympathy program.
Can you tell us a bit more about what the I Sympathy project will actually involve?
Firstly, it's a funded project. It's a 3-year funded project which operates in Northern Ireland, in Ireland and in Scotland. It's led by the Scottish Government. We received our funding from the European Union's Interreg BA programme, and that is managed by the Special European Union Programmes body. So ultimately, what we are aiming to do in this project is deliver 15,000 reviews over the next 2 years, and they'll be delivered by 10.5 pharmacists who will be trained in the I Sympathy delivery. 6,000 of those will take place in Scotland and 4,500 each in the Republic of Ireland and in Northern Ireland. So we're unique in Northern Ireland because we are delivering our medicine reviews in the hospital setting, so the secondary care setting, while in Scotland and in the Republic, they are delivering the reviews in primary care.
And what is the role of the Medicines Optimisation and Innovation Centre here?
Why are we involved in I Sympathy? It's because for the last 20 years, really, we have been looking at the role of the clinical pharmacist and the improving patient outcomes, essentially, and we have evidenced a lot of work over that period. And what we see with this is an extension of that current medicines optimization service improvement area that we have been working on for a long time. And what we do know is, I suppose, a lot of emphasis is put into an inpatient when they first come into the hospital and just before they leave. And sometimes that bit in the middle can lose out a bit. So this is where we are going to look at the real benefit of this I Sympathy project, because the pharmacists will be delivering an intensive medication review while the patient is in hospital.
So what will this involve for the project pharmacists on the ground?
So for us as project pharmacists, then we will be working to deliver these 4,500 medication reviews in the hospital setting. So yes, we are all prescribers, so we're able to action all of our recommendations ourselves, but obviously in close conjunction with our medical and other pharmacy staff. So we'll be discussing that, because they're a patient as well. So we're discussing all of that, but we can action a lot of the interventions ourselves. So we use the Scottish Polypharmacy Guidance 7 steps procedure to do our medication review. And the first question is, what matters to the patient? This is the patient. It's their life, their medicines. That should be number one, what matters to the patient. And then we also consider what medicines they're on that are essential or perhaps non-essential. We look at, are they meeting their therapeutic objectives? So is that painkiller working? Is the diabetic medicine reducing their HbA1c? So we look at that. We also look at if they're suffering any potential adverse drug reactions, or are they having an adverse drug reaction? And we'll consider if they need side effects to anything. And we'll think about the cost as well. So are they on the most cost-effective medicine? Medicines that patients don't take are not cost-effective. So we're looking at that as well, adherence. And lastly, we're looking at the patient's willingness and ability to take their medicines as prescribed. So there's no point prescribing this wonderful medicine if the patient does not believe it's going to work and will not take it. So it's no coincidence, I suppose, that the patients at the first step and at the last step, they are the center of the decision making about their medicines and their health. And we also provide, as well as looking at the medicines, we're providing a lot of information on non-pharmacological support for them as well. So self-care, how to do live with chronic pain, or resources that they may find useful, referring on to other people. So signposting to help them, take better care of themselves and to take ownership of their health.
That's useful, I can see. But pharmacists normally undertake medication reviews. So how will this differ from what they're doing as a rule?
Medication reviews do happen. Certainly, if a new drug's prescribed, they'll be checked for interactions, side effects, etc. Or when patients move into hospital, as Claire said, that coming into hospital and getting medicines reconciled properly always happens. But these in-depth reviews that we're doing take a lot of time. So if you're working in a busy GP surgery with only 10 minutes, or you've got a lot of pharmacists with a lot of patients waiting to see you, you don't have time to do this kind of in-depth review. And certainly there are lots of services available, maybe in specific community pharmacy clinics or GP pharmacist reviews. And we have specialised pharmacists in hospitals that do brilliant reviews, but it's not for all patients. So we're trying to do that bit in the middle, as Claire says, and trying to review these patients. But they do take time because we're really looking at the patient holistically. And what are their thoughts and their beliefs about their medicine, about their health? What do they want their health outcomes to be? What else can we find out? So, for example, maybe they haven't told people that they drink a lot of alcohol, or they smoke, or, all those other kind of things that we can tailor their healthcare for. And we'll also be reviewing things like, are they frail, or what their life expectancy is? What's the number needed to treat or harm with that medicine? But ultimately it's the patient, and a lot of discussion with the patient about what they would like to happen to their medicine. So if we decide a medicine's not appropriate anymore, we need to deprescribe that in conjunction with the patient, because otherwise it doesn't work. So it takes a lot of time.
What are you hoping to achieve with this project?
So by 2022, we hope that we have delivered 15,000 polypharmacy medicine reviews. As well as that, we want to have trained a total of 120 healthcare professionals in polypharmacy medicine reviews as well. So this may be doctors, hospital doctors, GPs, other pharmacists, nurses. So that's an important outcome for this project, so that it's sustainable going forward, that we have an exit plan.
And how will you measure the outcomes of the project?
So in terms of the actual data collection that we're going to do, we are going to use some tools that we have used previously in the past, the Eden intervention scale, which essentially assigns a grade to the intervention that the pharmacist has performed. That allocates a grade to the intervention, which shows an improvement in patient care. Some of these interventions may be significant intervention, but don't really have that big a difference in the patient care itself. But the majority of interventions we have shown are grade 4 or above, which indicate that there is also an improvement to patient care, as well as the added benefit of providing a cost avoidance using the SHAR model, which highlights the economic benefit as well, which we know is also important going forward. We also are going to use a validated tool, the Medication Appropriateness Index. Now, as part of this project, this tool has been adapted to include the person-centered element of this project as well. And members of the I Sympathy team have worked alongside the original author, Professor Joe Hanlon in America, to adapt this tool to make it a patient-centered tool that we can then use going forward. And finally, we are also going to ask for some prompts from the patient. So patient-reported outcome measures. And we hope to use an app that's been developed by the Scottish Government called Managing Your Medicines to identify improvements in the patient outcomes from their own point of view, pre and post review.
Thanks. That's really impressive. So what stage is the project at now? Have you started?
From, I think it was around February, we had all our pharmacists in post. So we have 10.5 project pharmacists working across the 3 jurisdictions. Certainly our 3 pharmacists have been in post since February and are out now currently delivering medicines reviews on the ward.
And finally, can you put the project into a broader perspective? Why is it worth doing?
So the goal is to produce a systems approach across health and care that is going to ensure the optimal and sustainable use of medicines for those with multi-morbidity to enable them to live active and healthy lives. So what we really mean by that is that we're adding quality added life years and not in poor health, so that you're adding quality to their life. And it's important for us because it forms part of the action plan here in Northern Ireland as directed by the Department of Health and our health board, and will also play a major contribution to the WHO's 3rd Global Health Challenge, which is to reduce the harm caused by medicines by 2023. But I think the person who can put it into the best broader perspective is Joanne, because she has hands-on experience of delivering these reviews.
Well, we've had a number of patients who, whenever we ask them what are their concerns about their health or their medicines, I'm taking too many. I don't know what all these medicines are for. Why do I need to take them? And they're so grateful whenever you go through and say, well, actually, we don't need this, or we don't need that, or perhaps we've identified treatment that's essential. Maybe a new patient where we started a statin, or we started medication to help prevent future events. So patients are really, really grateful, and sometimes they may not have told their doctor something that they will tell the pharmacist, or we're getting to draw out other information that might be important. So, for example, patients that drink too much alcohol that nobody knew anything about, and things like that. But patients really appreciate, the hospitals are so busy, and they really appreciate being able to talk about themselves and their life and their health and their intentions for their health. I'm grateful for being signposted to other areas that may help them. So ultimately, the goal is for our patients to have greater ownership of their health and their medicines and improve their outcomes. So yeah, really worthwhile doing.
Thank you very much, Dr. Scullin, Dr. Brown. That was terrifically interesting. For more information on the I Sympathy project and the contribution from the Medicines Optimisation and Innovation Centre, please visit our website using the link in the description. And make sure you subscribe for more news, videos and journals. For updates straight to your inbox, sign up using the link below. Thank you for watching.